A lot of people are like, I'm done with doctors. And I say, no, go back and prove them wrong and show them.
Mhm.
And because we, the doctors are getting their education largely from the pharmaceutical companies. I can tell you as a physician, all this, I just got my, I just did all my, a couple hundred hours of studying for CME for my license renewal, and all of it, every one of it is a pharmaceutical advertisement. It's just, you just read through this stuff and roll your eyes, and it's just drug, 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 drug. So good for you. It's good for you for sharing that and meticulously documenting that stuff, because I think it's very important that we do that. You mentioned you were diabetic, full blown diabetic. Do we have A1C comparisons? Do we know how that changed?
Yes. My A1C was 7.1 when I started.
Mm-hmm.
And the last check, I believe it was 4.6. Don't quote me on it. It's like 4.6, 4.7. But I have all of that on my website. Like I have everything on there so people can see, because that's the one thing people are like, oh, you're eating meat, you're going to be a type 2 diabetic. It's like, bruh, I already was a type 2 diabetic. I'm not anymore. And I'm wanting to, in the next couple of months, to do I think they dropped it down to 3-hour glucose test, because my physician, pretty much with my insulin resistance now improved and things like that, he's like, you have reversed your type 2 diabetes, is what he told me.
Wonderful. And it's interesting because you said you're 7.1, and actually, the American College of Physicians is now recommending that type 2 diabetics maintain a hemoglobin A1C between 7 and 8, which is like, it's insane to me that they're just saying that that's okay,
Very
that's
high.
normal. And that is clearly going to contribute to heart disease, blindness, kidney disease, amputations, things like that. And now you have a blood glucose that's better than 99% of the population at 4.6. I mean, you have a clearly a non-diabetic hemoglobin A1C. And the other things, because some of the critics will say that, well, you're just masking the symptoms. You haven't fixed diabetes. And what I often see, and I've seen this before, is, the things we're worried about with diabetes, the blindness, the retinopathy, the vascular problems, those two get better with this. I've seen people reverse their diabetic retinopathy. I've seen people improve their cardiovascular system. I've seen them improve their renal system. Their glomerular filtration rate actually recovers and improves. So it's more than just masking the symptoms. You're actually undoing end organ damage. Did you see any? Let's just go through, maybe if you're willing to share some other your objective markers of improvement. What would you say has clearly gotten better for you, and how can you show that?
I will say with the diabetes, I had actually started into having neuropathy symptoms in my feet. Mm-hmm. The sharp stabbing pains, Lord, they were terrible. Those have gone away. I had hemosiderin staining starting in my feet. I don't know if everybody knows what it is, but that's just when the blood pools in the lower extremities too much, and then it just gets pulled out of the bloodstream, and it causes, if you've ever gone to Walmart and you've seen somebody and they wear shorts and you see like pretty much from the knee down, it's purpley red, that's hemosiderin staining. I had very mild of it. It's completely gone. I didn't think it would ever go away. My feet are completely cleared up. That was stupidly because it was just a cosmetic thing, but I was so pleased when I looked down one day. I'm like, hey, the spots on my feet and ankles are completely gone now. The biggest changes, honestly, have been health-wise, but honestly, the biggest changes are mobility-wise. I went from having to use that walker, and I believe 6 weeks in, I was able to set the walker aside and stop using it. And I went from walking only a couple hundred feet, like our mailbox is probably 7 houses down, something like that. I would have to sit on the walker and huff and puff by the time I got there. I've been able to walk 5 miles. You probably know where this is, Larrabee Park. We've gone hiking at Larrabee Park. I can walk for a few hours without having to sit, when before I couldn't stand more than a few minutes without having to sit down. The biggest change, and most people would find this too embarrassing to admit, but I really don't care. I struggled to wipe my own butt. I did. At 360 pounds, I struggled. It felt like I had to like almost dislocate my own arm to do it. The day that I did it without effort, I cried. The lowest point in my life is when I had to ask my husband to wash my butt because I couldn't do it. Like that in my entire life, that is the lowest moment of my life. And so these are the things that are the biggest improvements, I think. I mean, the health has been extraordinarily important, but these are the things that have pulled me out of my depression. I had gotten to the point with my anxiety and my depression that I wouldn't leave the house for months at a time. Like I had to stop seeing patients because I couldn't leave the house. Like I was so anxious, I would have panic attacks. And I'm on half my antidepressant now. I just haven't. My doctor asked if I'd wait till this time of year passes before I got all the way off of it, and I agreed. I take half my antidepressant now. I no longer suffer from anxiety. I haven't had a panic attack since I started this. And my husband had to listen every single night that I would just, complain. I was in pain, but I would say, I wish I wouldn't wake up tomorrow. I was too afraid to honestly commit suicide. I had treated a patient when I lived in Minneapolis at the hospital that used a shotgun, and she had failed, obviously. And I was too scared to do it. So I just wished my own body would quit on itself. And now I wake up excited for life and motivated.
Yeah, that's so powerful. I mean, you're thinking you're in a situation where you're wishing to no longer be alive one way or the other. To, I mean, just interview, you're happy, you're energetic, you're smiling. I mean, you've gotten, I mean, life is now, I guess pleasurable again. And that's so incredibly important. And, I mean, to think about how many thousands, if not millions of people are in your very same situation. And, and many of them most of them, in fact, don't ever get out of that situation. And it's just, take another pill, here's another thing. And it gets very frustrating. Comparing yourself now to even a couple of years ago, quality of life wise, there's people who say, well, this carnivore diet is unsustainable. It's not safe. It's going to cause you to have heart disease or something like that. What do you tell people when they say that? I mean, would you say, well, oh my gosh, I've got a increased risk of heart disease. I better stop and go back to what I was eating, or eat a balanced diet with fruits and vegetables and whole grains and lean meats and things like that, which I'm sure you already tried. Correct me if I'm wrong. Perhaps you didn't, but I suppose
I
you
always
did.
have. I get comments like that on my channel all the time, like, "Oh, you're gonna die of a heart attack or a stroke," and it's like, I was 2 steps away from that where I was at 9 months ago. Are you kidding me? And my comment always back is like, listen, I actually see a cardiologist versus regurgitating something somebody else told you. How about you go actually read the studies? I actually enjoy reading studies. And I don't remember which one of the heart studies it is, but I was reading through it and they completely removed an entire cohort. It was 60-year-old plus because the LDL was higher, but their average length of life was longer. And because it didn't fit their hypothesis, they're like, we're going to just take this data out. And once I literally read that in the study, I'm like, they've just manipulated the data to make what they want to fit. And that's when I'm just like, my eyes were wide open. So I tell people, if you were genuinely concerned, I said, go read the studies. You may not understand, like if you don't have a medical background, there may be a lot you don't understand, but you will understand when you see them saying and admitting these things that they change the data. It's eye-opening.
Yeah, I mean, yes. I mean, there's a lot of studies out there that if you look, you can find that not everything supports this, this sort of diet heart hypothesis has been sort of prominent so far. What compelled you to be so eager to share this? There's some people that don't want the attention, or they don't want they're embarrassed by this, and I can understand. Maybe you're kind of vulnerable. You're showing yourself, hey, here I am. I'm definitely not very healthy right now. You've documented your journey. What compelled you to want to say, hey, here, world, look at me, look what I'm doing?
I had lost my why to live. When I was treating patients, I loved working with stroke patients and neuro-based patients because through my skills, they could go from being wheelchair bound to walking to going back to being about life. And then through the bureaucratic red tape of the medical community, it just sucked the life out of me. And I stopped enjoying it. And I had just literally stopped enjoying life because for me, what motivates me is to help people, to make tomorrow a better place than it is today. Like that is my goal in life. And I don't know what, like the light switched on, but I realized everything in life happens for a reason. We just may not see it for later on in life. And I used to question why me, in the sense of like, why do I have to go through all this misery, and all the suffering and all the whatever. And I just realized, you know what? I can take all that pain and suffering and share it with people because a lot of people, they just need one person to believe in them. They need one person rooting them on when they feel like the entire world is against them. They need one person. And I realized I can be that one person. I can get some responsibility for, doing this for myself, but also I can be that one person that can show if I can do it, because I am no special person. I have really, really poor willpower, really poor willpower. You don't get 360 pounds having good willpower. If I can do it, then others can do it. And that was my motivation. And that actually gave me my why back. There are very few people who are on YouTube that have shown it from the beginning. A lot of times it's I was fat and now I'm skinny. But there's so much in between that happens, the change, the lessons that we learn that I think are vital to share with other people. And honestly, I go back and look at my old videos frequently. If I'm feeling like down on myself or anything like that, I go back and look and I'm like, I was a completely different person.